Welcome everybody. My name is Jonathan Orlansky. I'm a senior BCBA with Applied ABC. I've been with the company for about 7 years, and I've been a board certified behavior analyst since 2014. Got my master's of education at the University of Washington. Anyway, I'm really excited to film this video for you and provide an overview of what it is we do as behavior analysts in the field of ABA. Um, we have the broad title of our presentation as What is ABA Therapy? And I'm going to go ahead and share my screen so we can get started. What is ABA therapy? Let's get right into it. So, understanding ABA therapy and how it helps children learn and succeed is our goal for today. Um, we're going to address some reputational stuff with our field and clarify some of the things we try to do to provide the best outcomes for our learners. So what does ABA stand for? It stands for Applied Behavior Analysis. It is a science that focuses on learning and behavior. It is rooted in the studies of B.F. Skinner, um, which is, of course, the field of behaviorism. The thing that distinguishes behaviorism uh, writ large from applied behavior analysis is the functionality of what we do. We take those principles and that philosophy, or not so much philosophy, but the science of understanding behavior as lawful and motivated, and we use that for, the reduction of interfering difficult behaviors and the acquisition of learning skills. So the core sort of relationships when it comes to applied behavior analysis and the understanding of how behaviors work is that there's an antecedent, which is what happens before the behavior, sometimes what causes the behavior. That's one of the things we study and collect data on. The behavior itself, which of course a behavior is any interaction with one's environment. Um, that one shorthand we have is the dead man's test. If a dead person can do it, it's not a behavior. But really, anything else that involves interacting with one's environment can be, which can be, what I'm doing right now as a behavior. It can be speaking, engaging in language, engaging in conversation. It can also be aggression or a tantrum. It depends on what we're studying and what we're trying to bring about. The consequence can be what follows. That can be, if I jump from a high surface, the consequence could be a natural consequence of me hurting my leg, or a consequence of me um, doing someone a favor can be a thank you. A consequence of a child engaging in a negative behavior could classically be timeout. It's whatever happens afterwards as a result of the behavior. So that this is a temporal sequence as well as a causal sequence. Antecedent before, behavior during, consequence after. And then what happens as a result of all of it is learning, as long as we are deliberate and we've put our studies and effort into it. The goal of ABA, goals rather, build communication, language and the ability to convey our needs and interact with other people is at the root of living a productive and happy life. Teaching life skills, and that goes hand in hand with increasing independence. The more you can do for yourself, the more freedom and ability you have. Reducing challenging behaviors. I alluded to that earlier. Challenging behaviors are the ones that make it more difficult for us to meaningfully engage with others and to learn. That's at the root of what we consider challenging is things that are meaningful obstacles to independence and social exchange and acquiring skills. What ABA is not, it is not punishment or forcing kids to change who they are. There's an association with sort of hyper disciplinary approaches, and that's not what we're trying to do. The idea, the core driving principle, as we'll get into, of ABA is reinforcement and association of behaviors with positive outcomes. So what we do is supportive and highly individualized. So here's how ABA works. Skills are broken down into smaller steps. that can either mean a task analysis, which I'll get into, which is breaking down a particular skill into smaller skills, or just taking language as a whole and seeing what the building blocks are. You know, are they able to repeat things first? If they're able to say repeat things, are they able to use language to get things? Are they able to use language to label things? We know how these skills build on one another and build upwards. So breaking things down into their smallest pieces and teaching them in a way that makes sense is a big part of what we do. Repetition and practice. This is in large part to make sure that what we're doing is scientific and data driven. Um, if you see someone do something once, that's great. Can they do it reliably? Can they do it? When they did it, was it prompted? Are they able to do it with multiple instructors in multiple environments? That sort of thing. So, making sure that we're building up a real solid foundation of evidence for skills is a big part of what we do and why there's so much repetition in practice. Positive reinforcement, like I said, the association of preferred behaviors, which can be the use of language, it can be asking for things, it can be using the toilet, uh, is associated with, wow, something amazing happened. I got this thing I love. People are happy. I'm happy. A clear association of preferred behavior, preferred outcome, and progress tracked. As I said earlier, the way we make sure that data is really solid and shows that things are a foundation, that's a huge part of what we do. Everything is data driven. An example of a skill breakdown, or as I referred to it earlier, a task analysis. Instead of just brushes their teeth, we see it as these distinct linked skills: pick up toothbrush, add toothpaste, brush, rinse, put away. And that honestly is a relatively small task analysis for toothbrushing. It could include picks up toothbrush, opens toothpaste tube, squeezes toothpaste onto toothbrush, closes toothpaste tube, turns on sink, rinses slightly, turns off sink, brushes fronts of teeth, brushes backs, that kind of thing. It can go up to as many as 20, but it also, again, everything's highly individualized. If we see a learner, with more skills in a particular area that requires less teaching, maybe we won't make it as detailed. It's just a matter of making sure we're not missing any part of it to make sure the skill is fully acquired. What is positive reinforcement? It can take many forms. Praise, most likely behavior specific praise, or BSP as we call it, which is not just great job. It's you picked up uh, you picked up your toys on your own, or you cleaned up after yourself, or you put the toothbrush on the toothpaste. That kind of amazing. Showing that we're really pleased with someone for and letting them know exactly what it is we're pleased with. Access to toys, of course, stickers or tokens. That can be great because kids can like to earn and accumulate over time. Those usually can be exchanged for a higher level reinforcer like toys. Activities could be being pushed on a swing. If we're talking about a token economy, it could be, earning access to the park or going outside. Sometimes it's just being played with, tickled, picked up, stuff like that. That all of that can be positive reinforcement. I was hanging out with a good friend who's a physical therapist this week who referred to ABA as slinging goldfish, which is a little reductive, but I thought was funny and on some level astute because what we do is ensure someone is getting access to positive outcomes, things they like as a result of these things we do. That we have a regular flow of could be snacks. We tend not to rely on edible reinforcers as much, but sometimes that's what's most motivating. And we want to make sure that association is really clear. So, yeah, all of these things are regular fixtures of ABA instruction. Why reinforcement works. It was what I referred to earlier. It's creating a positive association. A behavior is followed by something good that makes it more likely to happen again. And that's what reinforcement means and is defined as in our literature. A reinforcer is not just a preferred item. It is something that makes a behavior more likely to happen in the future. So it should have that clear association. Collecting simple data. So this is an example of an ABC chart. We talked about the antecedent behavior and consequence earlier. That is the most foundational way we might collect beha at least initial observational data on a behavior. So the example they give here, the antecedent, the teacher asked the student to transition from iPad time to table work, a non-preferred transition. The behavior is student screamed loudly, dropped to the floor, and kicked the chair. The consequence was the teacher removed the demand and allowed a 2-minute break. Now, probably not how I would recommend responding, but that's the thing is when we're taking this observational data, we uh, we're not applying the intervention yet. We're just getting a sense of what's happening. So the student wants to escape the non-preferred transition. It looks like they're successfully doing that in this case. They're not getting access to the iPad, to the teacher's credit, because obviously this is motivated by both escape from the demand of the transition and access to the preferred item, which they're not getting. This notes when it occurs, the time, how long it lasted, 3 minutes. The intensity was moderate. Um, wasn't just whimpering, but they weren't breaking windows. And the behavior stopped and the demand was removed. So that's just a note of what occurred. So anyway, this is all before, during, after, and then as many details as we can get. The fuller picture we get of as many behaviors as we can get, the more we can really speak to what's happening here. ABA is something that can be applied in any number of settings. Examples here, a daycare, a school, in someone's home. We do a lot of in-home therapy. In our clinics, which we have several of across the country, as do other practitioners. It can work in all of these settings because there's no place you can't draw associations between preferred behavior and positive reinforcement and non-preferred behavior and the absence of reinforcement. How ABA helps staff when we're in those other settings, like schools and daycares. We can make sure there are smoother transitions, better communication, fewer meltdowns, clear expectations. We are clinical and deliberate in what we do, and what we are driving at is fewer disruptive behaviors, which can have a negative impact on the other learners and environment, can be more stressful to teachers, and as well as teaching more and useful communication skills, which of course is going to help our student thrive in that environment, which is helpful for everyone. Individualized programs. Every child has unique goals and strategies. The person who ran my master's program at the University of Washington still does, Dr. Eileen Schwartz. Her favorite expression was, if you've met one kid with autism, you've met one kid with autism. They are all distinct. You can't draw any broader conclusions. Of course, having worked with a lot of kids over the years, you might say, oh, okay, this kid has this preference, and I was able to use this. I was able to bring in this reinforcement. It was really effective for them. You can try something, but there's no blanket approach. Everything is built from the ground up for each learner. Collaboration is of course super important. Um, Families are huge. I tell most parents, you are the world's leading expert on your kid. You know them better than we ever will. If we're going to have a foundation, we're going to approach things. Not only do we need your knowledge, but we need your participation because no one's influence is greater than parents when we're talking about children learning. Teachers working collaboratively and teachers have so much knowledge and information on what works or has worked and what hasn't, and circumstances of behavior, and when and how they're demonstrating language. They can speak to generalization. It's just such an immense resource, and as I said, we can also be helpful, and it can ensure positive outcomes for a learner, which is obviously what teachers and BCBAs and ABA therapists all want. Other types of therapists. I referred to a physical therapist friend who is married to a speech therapist friend. I have several occupational therapist friends. Their approaches, we have programming based around gross motor and fine motor and all elements of speech, including echoics and that kind of thing. But those sciences and therapies are so detailed and have so many wonderful tools and have their own libraries of literature and the benefit to working with those professionals it cannot be overstated. So anyway, if we're working with all of those groups, um, of course we're drawing from them and benefiting a great deal, and we're able to bring our perspective and expertise, and everyone working collaboratively is of course going to lead to the best outcomes. Um, we talked a little bit of, ABA is trying to make people, be this specific thing or it's punishment based or other kind of thing. BCBAs can or ABA can have a reputation of being like, oh, well, it's all behavior and it's all this perspective, which, of course everyone believes in their philosophy and their approach. But the idea that we don't work well with others is a completely misplaced stereotype. BCBAs love working collaboratively with other folks, at least the good ones. Um, Real life success examples. Here's the sorts of skills we teach, which can be in ways large and small, transformative for our learners. Asking for help. A lot of behaviors are attention based. Uh, Instead of kicking and screaming and throwing things, we can teach as a replacement a hugely productive and at the end of the day, simple skill like asking for help, which can completely flip on its head how learners interact with each other and with their environments and with their teachers. Following routines, that's gets to the heart of what we're doing in these school settings, daycare settings, in life. Everything sort of circles back to a routine and teaching the sort of comfort and reliability of that, which can be really uh, uh, at something our learners prefer once they see the larger picture can be great. Managing emotions, again, these kinds of skills, how to self-calm, how to recognize internally when something is going to overwhelm you, how to offset that with self-calming, is huge. And playing with peers, socialization is a part of every single treatment plan I've ever made, and insurers rightly ask that that be a part of everything because it speaks to the core deficits of autism is meaningful interactions with others or participation in social structures and interpreting social nuance and expectations. All those things are things that our learners need more time and practice with. And once they're able to play with peers, peer learning is such an important thing. And we're social creatures. Being able to develop friendships and relationships with peers is, what gives our lives deeper meaning. So that, of course, is hugely important. Common concerns. People think ABA is strict, and there's it all goes back to Ivar Lovaas, who was a very early ABA interventionist and experimented with electroshock stuff, which has been completely disavowed and is not a part of any kind of practice. But I do think and some of the Skinner behaviors and baby in a box stuff is probably that too. But it has nothing to do with ABA in practice in what anyone does in our field. Strictness is not at the heart of what we do. And in fact, I think when we're working with other learners, there's a lot of, okay, we're reacting in this very muted way to a behavior when like, shouldn't they be in trouble? Shouldn't we react like that? And there's this sort of concept of a sort of uh, uh, old world disciplinary punitive response, which ABA doesn't ascribe to because we're focused on actual outcomes and the actual function of the behavior. And oftentimes, a timeout for an escape motivated behavior is exactly what that learner wants. Even if it feels like you've done the right thing and administered punishment, it can be counterproductive because we are individualized and because we're focused on outcomes for our learners. Strictness really doesn't have anything to do with what we're going to do. We're precise um, because we want to make clear associations between what we want reinforced and what we don't. But strictness is not what we're trying for or what we do. Does it suppress personality? Um, this is a big thing. that folks will come at ABA for, and it's really not the idea. Now, there are divided groups in terms of like how we approach stereotypy. Some wonderful autism advocacy groups and autistic people who speak on their own behalf will talk about the importance of stemming and engaging in stereotypical behavior to self-calm and fulfill profound sensory needs. BCBAs have been listening to that and will only intervene with these kinds of things if it rises to the level of self-injurious behavior or something that imposes upon others' space or is so constant and disruptive that it's impossible to learn. Those kinds of things are maladaptive to the point that they block the ability to learn. But in terms of being able to express oneself and be quirky and be individual, that's what we want. We want people to express themselves and be themselves, and we're trying to give them the language and the skills necessary to be their fullest selves, not to be some cookie cutter automaton. Absolutely not what we want. Um, but the question of does it work? Yeah, it works. Being as data driven as we are, and being as sort of exacting and watching what's working and what skills are being acquired and that kind of thing, it's at the heart of what we do. And if it isn't effective, we tear back down and go back to square one and examine our targets and restructure things and it's all about if it's not working, it's not ABA. I mean that really is at the core of what we do. So the key takeaway, we hope, is that ABA teaches meaningful skills for real life. We take the core of behaviorism and a highly evidence-based practice and science, and we use it to teach real skills, reduce real problematic behaviors, and make a positive impact in our learners' lives. That's what we want to do. That is what we do. All right. Thank you so much. I appreciate you spending this time with me. It's been a pleasure. Please continue referring to these as is helpful. All right. My very best. Take care. Thank you.